High blood pressure doesn't always come with warning signs. No pain. No symptoms. Just quiet pressure building up behind your eyes, inside your chest, and around your heart, year after year. And for most of my older patients, the first sign is a scare, a spike on the cuff, dizziness, fatigue, or worse. But here's what I've seen after 25 years in practice. You don't always need to start with medication. In many cases, blood pressure can be lowered naturally, with real, measurable results, using simple changes and science-backed remedies. So in this video, I'll share the 5 natural habits and remedies I've personally recommended to older adults that helped lower their blood pressure, safely, gently, and effectively. Let's start with the first one. You probably already have it in your kitchen. Remedy number 1, add more potassium-rich foods, not just less salt. When I first meet patients with high blood pressure, most of them expect me to say, cut the salt. And while that's partially true, it's only half the story. What many seniors don't realize is that boosting potassium is just as important, sometimes more. Potassium acts like a pressure valve in your arteries. It helps your kidneys flush out excess sodium, and it balances the electrical signals that control your heartbeat and blood vessel tension. One of my patients, Jerry, 72 years old, former truck driver, had sky-high readings for years. He didn't want more pills. We started with food. I asked him to include potassium-rich options every day: bananas, spinach, white beans, avocados, and sweet potatoes. Just natural foods. Within 4 weeks, his readings dropped by 10 points, without any new medication. It's not magic. It's physiology. And if you're on blood pressure medication, even a modest potassium boost through food, not supplements, can work with your treatment, not against it. So don't just think less salt. Think more potassium. Let's move to remedy number 2, and this one requires no food, no pills, and no gym membership. Remedy number 3, cut hidden caffeine, especially after noon. In the hospital, I can't tell you how often I see older patients come in with irregular heart rhythms, high blood pressure spikes, and they're puzzled. No change in medication. No new diagnosis. But when I ask what they've been drinking, the answer is almost always the same. Just coffee, and maybe a soda. Caffeine hides in more places than you'd expect. Not just coffee, but also black tea, green tea, soda, chocolate, and even some over-the-counter painkillers. And while younger bodies can handle a bit more caffeine, I've seen time and time again that for seniors, caffeine lingers longer and hits harder. It causes the heart rate to rise, constricts blood vessels, and can trigger pressure surges, especially at night. One of the first things I recommend to hospitalized patients with unexplained spikes is this: cut all caffeine after 12 p.m. Within days, we often see calmer readings, better sleep, and less anxiety. It's a simple adjustment, but one with powerful impact. Now, let's move to remedy number 4, a mineral your body may be missing without you even knowing. Remedy number 4, magnesium, the overlooked mineral that calms blood vessels. In nearly every blood panel I review at the hospital, especially among older adults, I see one recurring pattern: low magnesium levels. It's incredibly common, and most people have no idea. Magnesium is essential for vascular health. It helps relax the muscles around your arteries, making it easier for blood to flow and pressure to drop. Without enough magnesium, blood vessels stay tense. It's like trying to push water through a narrow hose. But here's the part most people don't know. Diuretics, common in blood pressure medication, actually deplete magnesium. So even patients trying to manage their pressure can unknowingly make the problem worse. The solution? Add magnesium-rich foods like pumpkin seeds, almonds, dark leafy greens, and beans into your diet. And if you're considering a supplement, always run it by your doctor first, especially if you're on other medications. When magnesium levels stabilize, we often see better sleep, calmer nerves, and steadier blood pressure, naturally. Now let's move to our 5th and final remedy, and it might surprise you. It has nothing to do with food or pills. Remedy number 5, deep breathing, the 5-minute routine that calms your heart. Let me tell you about Elaine. She's 74, a retired nurse, sharp, kind, but constantly anxious. Her blood pressure was unpredictable. She'd be fine in the morning, but by evening, spikes, tight chest, racing pulse. She didn't want to add more medication. So I showed her something simple we could do right there in my office. Box breathing. Inhale for 4, hold for 4, exhale for 6, and rest. Repeat. We did this together for 5 minutes. When I checked her blood pressure again, it had dropped noticeably. What happened? Deep breathing activates the vagus nerve, which tells the body to calm down. It slows the heart, opens the blood vessels, and reduces stress hormones, all of which naturally lower blood pressure. Elaine now does this every evening before bed. After 2 weeks, she was sleeping better, and her evening spikes were almost gone. No equipment. No pills. Just breath on purpose. It's one of the most overlooked but powerful tools I've seen for seniors. And it costs nothing. Let's wrap up with a quick summary and call to action. Ready? Now before we wrap up, I want to leave you with 3 extra tools. Simple, natural habits that I've seen work time and time again in real-world settings. These aren't trendy gimmicks or hard-to-find supplements. They're gentle, effective practices that you can add to your routine starting today. Each one supports healthy blood pressure in its own unique way, and when paired with the 5 remedies we already discussed, they can take your results even further. Let's go through them one by one. Bonus tool number 1. Coconut water. Coconut water isn't just a trendy drink. It's one of my go-to natural suggestions for older patients struggling with hydration and high blood pressure. Why? Because it's rich in potassium and magnesium, 2 minerals most seniors don't get enough of, and both of which play a critical role in regulating blood pressure. Potassium helps the body flush out excess sodium through urine, which reduces fluid buildup and lowers pressure in the arteries. Magnesium helps relax blood vessels, making it easier for blood to flow. Together they're a powerful natural duo. I recommend unsweetened coconut water, without added sugars or flavors. Just 1 small glass a day, around 8 ounces, is enough to give your body that gentle support. Some brands are high in sodium though, so always check the label. It's especially useful for seniors who don't like drinking plain water or who struggle to stay hydrated due to medications, mobility, or appetite loss. No, coconut water won't replace medication. But I've seen patients who add it to their daily routine notice better hydration, fewer cramps, and lower systolic readings within weeks. It's a simple addition that's gentle on the stomach and your arteries. Bonus tool number 2. Swap table salt for herb blends. One of the biggest hidden culprits behind high blood pressure in seniors is not just how much salt they eat, but how often they add it without thinking. Most of my patients grew up in a time when adding salt to everything was normal. It's comforting. It's familiar. But here's the truth. Even small sprinkles of table salt throughout the day can keep blood pressure high, especially when paired with packaged or processed foods. What I recommend instead is a full switch. Replace table salt with salt-free herbal blends. These are flavorful combinations of herbs and spices like garlic powder, onion powder, basil, parsley, thyme, rosemary, lemon zest, or even smoked paprika. Not only do they add bold, satisfying taste, they also help retrain your palate to enjoy food without extra sodium. Over time, your taste buds adjust. Most patients report that after 2 to 3 weeks, salty foods actually begin to taste too strong. And better still, their blood pressure begins to stabilize, even before changing anything else. This is one of the easiest, most affordable tools I recommend. No side effects, no medication conflicts, just a smart flavor swap that supports your heart health every single day. If there's one drink I wish more seniors knew about, it's hibiscus tea. This isn't just a relaxing herbal tea, it's one of the most studied natural remedies for lowering blood pressure. Hibiscus contains compounds called anthocyanins and natural ACE inhibitors, which help relax blood vessels and improve circulation. In fact, several clinical studies have shown that drinking 1 to 2 cups of hibiscus tea daily can reduce systolic blood pressure by up to 7 points, often within a few weeks. I tell my patients to look for organic, caffeine-free hibiscus tea bags. You can brew it hot or cold, and if the tart flavor is too strong, a slice of lemon or a cinnamon stick can make it more enjoyable without adding sugar. And no, you don't need to overdo it. 1 or 2 cups a day is enough to support your heart, gently and naturally. It's also a great alternative to sugary drinks, which can quietly contribute to both blood pressure and weight gain. So if you're looking for a simple daily ritual that truly supports your vascular health, hibiscus tea is one of the best-kept secrets I can share. Let's take a moment to go back over what we've learned. You now know the 5 natural remedies I've given to many of my older patients. Things like adding potassium-rich foods, walking just 20 minutes a day, cutting caffeine after noon, restoring magnesium through food, and using deep breathing to calm your blood pressure naturally. On top of that, I gave you 3 bonus tools that truly work. Coconut water to gently support hydration and mineral balance. Swapping out table salt for herb blends to protect your arteries. And hibiscus tea, a powerful, natural drink that's been shown to reduce blood pressure when used regularly. Now look, you don't have to change everything overnight. I always tell my patients, pick one thing, just one. Because real, lasting health happens step by step, not all at once. If this video gave you something useful today, subscribe to the channel, Vital Steps. I'll be here every week with clear, practical videos to help you sleep better, move easier, and take control of your health, without the confusion. I'm Dr. James Rowe, and I'll see you in the next one.